We are glad you're here with us today on 5 City TV. I'm Dale Johnson, sitting down today to talk about Lincoln Fire and Rescue with Fire Chief Michael Despain. Chief, good to have you back.
Good. Thanks, Dale.
A lot to talk about today. We break down a portion of the 2016 annual report. I know, it can be a little ho-hum, a little ha, but hear us out, please. This report contains outcomes, comparisons, goals, objectives, which are impressive and noteworthy, so stay with us on this. They translate into lives and property saved, maybe your life, maybe your property, so it is worth talking about. But before we get to all that, Chief, and our spreadsheets and PowerPoint, I'm still abuzz about the new fire truck at Station 7. Right. Bill Clinton was president. The last time a new fire truck rolled into Lincoln, 1996. And I was part of the initiation at Station 7. Had a lot of fun.
Yeah. My wife and I were parents of twins, and they were born in 1996. So I think of how far that's been since a new piece of apparatus was built or purchased for Lincoln Fire. And so we're certainly pleased that that new rig showed up. It's already making a difference in this, in the sense that that's one less truck that we're dealing with chronic mechanical problems. So we're already feeling the results. Of course, we've got another truck and 3 more engines coming literally any day now, and so they're slowly being developed to get them back in the station. And so hopefully we'll have 5 new rigs rolling around Lincoln here pretty quickly.
And you saw the community turnout.
Yeah, I was actually very pleased with that. We knew that we would have some community show up because we know we have community support, but I think I was a little overwhelmed with the number of people that showed up on a kind of a hot, muggy day with a little bit of a chance of rain. And so, but that's just the sign of the level of support we get from the city of Lincoln, and in particular the communities surrounding each fire station.
So if you live in the South Cotner, A Street area by Bryan East, just check out that 105-foot fire truck that's
nice.
Backed in. That's very, very nice. Let's get to our presentation today. We're looking at some of the 2016 annual report, and we'll start with breaking down the calls. Chief, take us into the first slide.
Okay, well, let's just start with maybe what the purpose of the annual report is. Good. So the annual report's purpose is to report a little bit of what we've done so far, but in particular, it's really to show you what's in it for you as a taxpayer, as a customer. What level of service are you getting? And so we tell you what it's going to be, but some of these slides show the level of service you're getting, and sometimes it gives us a chance to correct a few issues. So for this first slide, is a good example. Is this is all the calls, 25,000 calls come in every year through Lincoln Fire and Rescue, and this is how they're broken up. And so we list this just to show one of the common misperceptions that comes out is that we run nothing but medical calls all day and there's really no fires. Well, that's true if you look at a graph like this. This one shows a pie chart where 82% of the calls are medical, but what it doesn't show you is that an EMS call is a very short duration, a fire is much longer. So if I was to recreate this graph into hours, it would be almost 50-50. 50% of our time would be on fires, 50% of the time would be on EMS. And so those are the things that we're trying to work through with the annual report to just kind of clarify the conversation so people understand impacts and the good and the bad of what happens in the city.
You and I have talked about that, but that chart will surprise some people that 8 out of every 10 calls, every time there's a siren going off, 8 out of every 10 is for a medical call.
Right. Now, for the fire call, though, there'll be 5 or 6 or 8 units going to that call, whereas on a medical call, there's typically 1 or 2. And so the number of calls that come in for 911, 80% are going to be a medical-related incident. The rest of them will be kind of fires and hazmat and those kind of things. But when we go to a hazmat call, that's multiple units. We go to a fire, it's multiple units. And those 2 call types in particular, we're out for hours and hours and hours at a time. Whereas a medical call, typically we can go to it, clear it, and be ready for the next one in about 30 minutes.
And then hazmat calls in a special team.
Yes.
In some cases, depending on the situation.
Yeah, hazmat, long drawn out.
All right, so we break it down even more. We showed you that 82 some odd percent EMS. Now let's go for a fire unit. 90% of the time a rig pulls up at the scene of a fire.
Right.
6 minutes and 20 seconds.
Right. So if you want your fire put out and you want to save lives, you want to save property, lower your insurance, mitigate blight in a neighborhood, not be displaced from your house for weeks, months, or years at a time. You want us to get there quickly, not just to put the fire out, but put it out before it gets to that point where it's done so much damage that there's really no point in rushing. We're not there to put your house out anymore. We're there to put the next person out. But in this graph, what we want to do is we want to try and be about 90% of the time, meaning 9 times out of 10, when you call for the fire at your house, we can get there in 6 minutes and 20 seconds or less. Now, anything above 70 is, I say it's not okay, but 70 is credible, meaning when you look at a national average, they'll say, okay, that's okay. Stay between 90 and 70. If we ever got above 90, that would be great, but we would change the model. We would say, do it in 6 minutes even, not 6 minutes and 20. Get faster if we can. But 6:20 is a pretty reasonable model. And so this is not we're not very proud of these stats. This is not the best stats we have, but they're okay. We just want to make them better. And really, the station relocation project that we're working on. So it's interesting to see this graph in about 18 months to 24 months once everything's up and we have some data. I think we're going to see significant improvement in this one, and that'll be a benefit to the community, whether that's not just lives saved and property saved, but it's also lowering insurance rates, improving the quality of service for people in all areas of the city, not just the urban core. So
What's a logical incremental increase from that 71.1?
well, when the new stations come in, we expect probably about a 10 to 13%, somewhere in there, improvement. A little bit of that's going to be with the new CAD system too, and it's really not a new CAD system, but it has to do with how we send the closest unit. Right now, we have to kind of guess who's closest because the CAD doesn't recognize it. We talk to each other to figure it out. The CAD will do it automatically. So we figure between those two issues, you might see a 20% improvement. Now that's 20% over 70, not add 20 to 70. So it may be 80 to something like that is what we're thinking.
I would think that's impressive.
Yeah, no,
You've cut that 20% down, you've
That's
cut
huge.
it in half.
Yeah, we will have good measurements after that.
And not every fire requires a large number of firefighters, but when it does, we'll choose a number 16 to 19 are needed.
Yeah, now this one is probably one of our worst measurements, and again, this is because the number of firefighters you need on an incident are larger than you would on a medical call. And so to get 16 to 19 firefighters in the urban core is hard enough with the way the stations are, but we're okay. But when you look at those areas where there's just not a station, they don't get the first unit, they're delayed on the second unit, they're delayed on the third unit trying to come in. And so to get that many firefighters there are just terrible. So this one is one of our not so proud measurements, but it is, we're trying to be transparent here. But this is another measurement we anticipate significant improvement on with the station optimization plan. So again, I think we'll be above 70 once that's done. And the way we deploy our apparatus within another, again, 18 months, 24 months, good 2 years to get some data, and I think we'll see better numbers here. But in the sake of being full disclosure, we want to make sure people understand this is where one of our challenges are. And when you move this up, it's all those other issues we talked about effective response force, preventing injuries, all those pieces are going to improve. So, but this is one of the things that give us another year to two and we'll see some significant improvement, I
But
believe.
you moved from the red into almost the green. Again,
Yeah.
your attempt is to cut the gap down in
Yeah.
half,
Yeah.
which is what you try to do. All right, we've talked about containing a fire to the room of origin.
Yeah.
And how that has a multiplier effect in
Right.
terms of property damage, structural integrity of a house or a structure. And right now it's 85%, and the national average is 80? Chief?
There is no national average on this, and that's the thing that's kind of interesting. So even though I showed you the other data that looked bad and the station optimization plan will help you, when we look at outcomes, like what do you want as the customer, if we can get there quick enough to stop a fire at room of origin, 80% of the time, that's a pretty decent, that's really the most important measurement in terms of outcome, besides lives saved and injuries. And so even though our deployment is really hurting, we're still okay with where we are. I would like to see this a little higher, like around 90 in terms of outcomes, but this is one of the things where I think Lincoln Fire is kind of leading the industry a little bit on. Some things we measure no one else does. And so when we try and do regional partners to say, what do you do? Can we compare cost per capita we get, the number of firefighters we get, minimum staffing we get, but we don't get this kind of stats. And so this is important for us in terms of lowering insurance costs across the board. So the fire may not be in your neighborhood, may be totally across town. What do I care if we open a station on the southeast side of town if I'm on the northwest? This is where it matters, is because it starts impacting insurance.
So what factors go into helping you increase that? It starts with dispatch.
Yeah,
I mean,
good 911
this is a
center is
team effort
important.
here.
Yeah, if the dispatchers didn't do what they did, we couldn't do what we do. So good dispatchers, early notification, quick turnout time, apparatus in the right location, so we get the first one there quickly, we get the 16 to 19 effective response force there quickly. They have the right tools and equipment to do what they need to do. So back to the fire truck, if we didn't have fire trucks that start and get us all the way to the incident, then they're no good to us. And so all that investment in the firefighters make no difference because we didn't get there in time to make a difference. So
A lot of it's location.
exactly. So this is this just kind of puts us back to we weren't as bad as we thought. We need to work on it, but this is the outcome that really will make a difference at the end of the day.
Numbers up to this point of yo-yo nationals and goals and actuals. This one, you're right on target as far as the value of property and contents threatened by fire.
Yeah, yeah. This is one where when we get there and we can stop it at room of origin, this is one of the other outcomes. And this really has, this is where we kind of tie it more to the insurance cost, is if we can save 95% of the value of the property, then you're less likely to have a claim or a sizable claim that impacts everybody else. And so historical fire loss is one of the quickest ways to get your insurance increased, short of having a fire in your own house. That's the quickest way. But if we can do this across the board and we can save property, then this is the real outcome for the customer, because that keepsake that's important, the pictures, things that are irreplaceable, that's what we're also trying to save. Insurance can replace part of it, but I don't know how you do the keepsake or something that's really important to you, sentimental value. So this has an aspect too in terms of what the customer wants, and the community stakeholders told us some of the things that are important to them, and so we start putting this in there. And again, very few agencies do this kind of measurement.
You mentioned the stakeholders. During the course of the 9-week worth of presentations, you had an insurance industry representative talk to us. And while I found that fascinating, I also found it a little confusing. So our next chart goes into the Nebraska versus countrywide, we call it ISO.
Right.
Why don't you take some time and explain what we're going to be seeing here for the next slide?
So a lot of the insurance companies work with it's a for-profit agency. It's not a government entity, it's a for-profit agency. But across the United States and even into Canada and other countries, they will go into a community and they'll look at certain occupancies, certain big buildings, commercial primarily, and they'll also grade the city as a whole in terms of what level of fire protection they have. And they really grade it in 3 areas. They'll do it in the water system, so fire hydrants. They'll do it in the 911 center, how well your dispatch center is staffed and how well it works. And then the deployment, how many engines, how many trucks, how many firefighters, how quickly can you get to the incident. A lot of the measurements we have here are not to the detail they require, but it's all connected. And so when you look at Lincoln, it doesn't really grade how good your firefighters are. You could have great firefighters, but if we can't get them there because the water system, the 911 center is not working right, or we don't have the right tools and equipment, they just look at outcomes. And so they look at historical fire loss, they look at your historical performance in getting on scene, and they give you a grade. And so the grade is from 1 to 10, and 10's being the worst, 1 being the best. They would give you that grade, and then what they do is insurance agents can use that data as a part of the formula to dictate how much you pay for the fire premium portion of your insurance. So a lower ISO rating means lower insurance. A higher one means in the numerical value. So we want to be closer to 1, and we want to be way far away from 10. And so this graph here will show where we set in the state of Nebraska, and really I use countrywide because it's really bigger than just the United States. But when you look at that, we're in ISO 3, and that's pretty good. If you look at the bell curve, we're way over on the left, and that's where you want to be. You want to be class 1, 2, or 3 if you can, and that's where we're at, so we're fine with that. But we are, there is kind of this feeling within LFR that we would like to try and at least push towards a class 2. And the reason is some insurance providers in town have reported that, the difference between a 2 and a 3, there's a little bit of measurable difference, meaning you could see a slight reduction in your insurance if we went to a 2. It would be about the same. A 2 or a 1 are about the same. So we don't have to actually push for a 1, although that would be nice. But a 2 makes a difference. If we drop to a 4, even though this graph shows some difference between 3s and 4s, that's just the number of agencies that where they fit. The math is a little softer, so to drop 1 is not so bad, to move forward is a little bit better, but as soon as you hit about a 5 or a 6, then it starts adding up quickly. And so as a good example, if you were to just be across the street outside the city limits and you were in one of the rural districts, it's likely your insurance will go up by about $1,000 a year, $1,300 a year. So you're going to pay quite a bit more in your annual insurance rate just by being across the street because of how this ISO rating is impacted. Again, not an indictment on the quality of the firefighters in the rural districts or LFR, it's just the way the math and the science add up for these companies based on years of data.
And I think it's important to note that it isn't just the firefighter response, it isn't the training that goes into the skill level of the firefighters, it has to do with adequate water supply,
Right.
where the hydrants are located, all of the other factors that are outside the direct control of LFR can make a difference.
Yeah.
That insurance rating.
Yeah, so we had an ISO agency come in and do a rating on the city of Lincoln literally within the last 6 weeks, and we'll wait. It takes about a month or 2 for them to calculate the results and let us know. I think we'll stay at a 3. I think we'll be okay. There is a chance we might drop to a 4 just because of the station optimization plan hasn't been fully implemented. But they assured me that if that happened, that as soon as we got the stations up and running, they'll come right in. And usually do this every 10 years. They'll come in within a month or 2 after requesting, and they'll fix that so we can get it back up. So not too worried about it moving forward because of the planning that was put in place many years ago with the station optimization plan.
Do I see this correctly? There are no 1s?
Well,
in
there is.
Nebraska?
So there is one. There is one class 1 in Nebraska, and I think the city of Grand Island just got it, and so kudos to Chief Corey Schmidt, who's the chief over there, that he got him there, so that's great for them. But it doesn't have to do with size. You can see Grand Island considerably smaller than Lincoln, but they're doing some things right. So,
All right, back to other statistics here as we continue to talk about the 2016 annual report here with Fire Chief Michael Despain. First unit arrivals, 54.6%. You're a proud man. You'd like to see that higher.
well, yeah, we want to see this a little higher, but this is what you've seen before. We're all fire related. This is the EMS side of it, and just as important, obviously. And so this one has to do with that first unit on scene. And so the municipal code dictates when we have an ambulance on scene, and that's a different measurement we'll see here in just a sec. But really what we want to do is see this first unit get there quicker. And some of the controversy that we hear is, why do you send a big fire truck to that medical aid? Why don't you just send the ambulance? And the reality is we have 14 fire engines in town. We only have 6 medic units or 6 ambulances. So the chances of getting help is faster with the engine company, and then they follow up with the ambulance. And so that ability to get service in the very south end of town, with 8 minutes of drive time, we can typically get an ambulance even into the farther south, but we can't do it in this mount because there's no stations there. So that's what's really hurting us, is the areas that have lack of coverage, and it draws the math down because it's a growing population, and we're running a lot of calls. There's senior living establishments that generate a lot of calls. They're in those areas uncovered, and so it just gets worse over time. So again, we believe that this will improve with the new stations that you'll see in different parts of town and the relocation. And our goal, again, is to get this up much higher because this has an impact on that cardiac survival rate. Things like strokes, sepsis, there's trauma, bleeding, there's a lot of things where time is important, and so we want to get that first unit there quicker, even if it's not an ambulance. We want to get somebody there that can help. Ambulance will follow in.
I understand it, being a task force member, why a fire truck, an engine accompanies an ambulance. Is that one of your primary public
Yes, yes.
responses is,
Yeah.
here's the reason why?
Yeah, we get it on social media. We'll send it out all the time. Why did you send that big engine to this? And again, remember, it's not about sending the smallest unit you need. You have to look at it as, we don't know what we're going to, number one, till we get there. And then once we get there, there's many cases where even if it's not a cardiac event, you need more than 2 people to handle the patient. Sometimes they're in an awkward area of town, of their building, to get them out. So getting them onto the gurney and getting them out. Getting them over steps. Sometimes we have people that are pretty heavy set and you need multiple people to help articulate them from a basement or a second story to down. So a lot of medical aids require a lot of staffing to get that done. So it's not just, why did you send that big truck or that big engine when you should have sent the ambulance? There's a lot of aspects behind the scenes. And so
And I will say, having gone on calls, if there are 6 personnel there, all 6 are doing something. It isn't just 3 people are taking care of the patient or patients,
Right.
and the rest are just watching. Everyone has a task. It's a coordinated dance almost.
Right.
Everyone knows what they're going to do, how much time it takes. You don't look at each other and say, do you want to take this? I'll take this. Everyone knows what their role is.
Yeah, fairly well scripted. And remember, there's always one person that may look like they're standing back, but that's the officer making sure that the scene is safe and we're providing for all the aspects of that patient care, but also documenting. We get sued quite a bit, and so we need that documentation. And if I was the patient, I would rather you treat me than worry about documentation. But if I'm the taxpayer and I was paying a lot of extra money out because the agency kept getting sued because they had no documentation to protect themselves, then I would be upset. This is the balance. It takes care of the patients, takes care of liability. I wish it wasn't that way, but this is America, and that's what happened. So we have to protect ourselves.
What impressed me, Chief, is someone is talking to the patient. How you feeling? How long have you been lying down? What did you do before the episode? While other people are hooking up equipment, another person is going through medications, asking another person in the room, if there is one, a spouse, for example, what medications could you get those for me? He or she documents those medications. Everyone is coordinating, and all for the good of the patient. I've been impressed on the calls.
Good.
That I've been to. All right, next, the ambulance arrival.
Yeah.
8-minute time.
This one is, you want to get somebody there quick as you can to treat the patient, but then you got to get the patient to the hospital in most cases, and so we need to transport. There is a municipal code that requires us to provide ambulance transport services within 8 minutes, and so this is actually codified in the municipal code. We have to follow this one. Now, this is a very good number, so we're very pleased with this. It'd be difficult to get much higher than this, because to meet 100% of the call time in 8 minutes is unrealistic. No one really can do that. So this is a good number, so we're pleased with this, although we anticipate if we don't add medic units into the system, you'll start seeing this drop to 85, 84, 83, some of that impact will happen. And so right now we've got a couple of mechanisms in place to make sure that doesn't happen, but this is one of the unique measurements where we have an actual code that requires us to do it. And it's our own code, it's not a national standard, but this is one we have to watch pretty close.
Very proud about the fact, as we continue to talk about the 2016 annual report, that cardiac arrest incidents,
Right.
Lincoln is just far and away on top as compared to the rest of the country.
Yes, we are very pleased. That's one of the things that we really want to tout and make sure people understand what the firefighters and the medics and the local hospitals, that partnership is doing. But it starts with some things as simple as good CPR. And so this latest graph will show you the CPR fraction. And so Dr. Jason Kruger, who's our medical director, recognized when he came on a few years ago that sometimes just good CPR makes a big difference in cardiac survival rate. Not only from firefighters, but from the community. So we want the community to know hands-only CPR, dial 911, those are some of the best things you can do to save someone. But when we get on scene, we need to keep that cardiac pace up. Otherwise, all the speed meant nothing if you don't do CPR right. So we record all of our firefighters. It's all live. It's all recorded live, and then we look at it later. But they can see monitors to see how they're doing, what's their pace. We look at it afterwards for like an after-action report and say, hey, you were a little slow, or your pace was a little slow, your depth was a little light. to improve that. But that has made a huge difference in our cardiac survival rate, as we'll see here in a sec.
And the few paramedics compared to the entire personnel staff of paramedics, they take such pride in being able to increase their efficiency on scene.
Yeah.
So
Yeah.
once this critique does happen, Chief, in the paramedics that I know, they're going, okay, I'll do that.
Yeah.
I can do that.
Yeah.
It's almost a challenge to themselves to better themselves.
Yeah, well, the cardiac survival rate is now kind of a source of pride
Yeah.
within Lincoln Fire and Rescue, and so we want to keep pushing that number up. And it's not just with us; it's with the local hospitals. It's with Nebraska Heart Hospital and St. Elizabeth and Bryan. They all kind of like this too, and they're part of it. We can't do it without them. And so the reality is, anything we can do to help push it forward. I mean, it's firefighters. That's how they're wired. But that's great. The customer, as the taxpayer, getting that benefit. I mean, this is one of the best places in the country to be. If you have to have a heart attack, do it here.
And you've had correct me if I'm wrong, but you've had other communities contact you and say, how is Lincoln doing this?
Almost on a weekly basis. Almost on a weekly basis. We've actually had cardiac, we call them cardiac camp here, where they would bring in agencies from all over and invite them to come in and see what we're doing.
Right. The cardiac survival rate, 60% or better,
Right.
is our next.
Yeah, so if you look at this slide, you can see our goal is 60 or better. We're doing it at 72, and
There it
so
is.
that graphically looks nice, but really this one is the one that I'm impressed with.
It's the
really
colors,
how we,
Chief.
it's the colors, of course. It's how we compare to the national average, and so
Look at
the
this
national
difference.
average is somewhere around 25%, and we're significantly higher than that, and that's an impressive number. I mean, it's hard to argue with those numbers, and we're pretty pleased with it. And again, this is for ending 2016. So those numbers always change the first couple of months of the year. So we keep an eye on this, but that's been an improvement 3 years in a row. Keeps rising 3 years in a row.
If we could just go back to that slide, and I want to make sure people pay attention. Look at the difference. Just forget the colors. 25%, 72%
Right.
of the time here in Lincoln, people are going to be
Right.
able to walk out of the hospital. Their rate of their potential for
Right.
being able to carry on with their lives is so much more
Right.
better in Lincoln, Nebraska than it is across the country.
And one of the things that we have to consider is that there's two types of heart attacks. There's the one you cannot survive. If you were on an operating table, could not survive it. There's ones that you can. So we do differentiate. So this doesn't mean 7 out of 10 heart attack victims survive. What it means is 7 out of 10 heart attack victims that have the type of heart attack that you can survive from, we can help you. We can get you back. And that's not only your heart started, but mentally, we can help protect your mental capacity in terms of lack of oxygen to the brain and that kind of stuff. So still an impressive result.
Very impressive, very impressive. And our final slide here,
Yeah.
LFR treating and beginning to transport all patients with strokes.
Yeah. Final one is
Suspected
we don't know, this is a good example of something we measure that we don't know if it's important yet. We're still kind of working through the hospitals and Dr. Kruger and those to say, does it make a difference or not? But we want to measure it just in case it does. And if we later find out that it doesn't, then we'll drop this measurement. But we said until we know that it doesn't make a difference, let's push hard in case it does. And so right now this is our performance so far, and we're pleased with that. I think the stroke performance in Lincoln is good in terms of survivability and outcomes, but we don't know that that's directly related to what we're doing or treatment in the hospital. And so there's always variables, but we want to make sure we keep this variable up until someone can exclude it. But it's just one of those things that we just want to demonstrate that we're willing to be experimental. We're willing to do a little research and development, a little bit outside the box if we think it's going to help.
And quickly, where does this 2016 report go?
So the 2016 report is almost done. It's still in draft form, going through a few more layers at City Hall for them to look at. But these are the kind of the core results. The issue is really just the formatting and executive summaries and that kind of stuff. But I think we'll have that out probably in about a month. And there's much more to it. This is just kind of the highlights of it. There's much more to it. Some of the best ones that we haven't talked about is price per capita. How do we compare in cost, taxpayer cost, to other agencies of like size? Kind of what other outcomes that are important to the community. And so there's more than just this, but this is a good start, I think.
Good place to start, so we'll talk more about it. The 2016 annual report. access it eventually online?
Yeah, we'll have it online. It'll be public record here pretty soon.
Thank you, everybody, for joining us today. Fire Chief Michael Despain on 5 City TV.